The real challenge for us is going to be identifying the 100 below, finding them, locating them,
Right.
getting to them, and it's the tough population. So that's going to be one of the hardest parts.
Yeah, and we'll do our best, but you're right, we don't get to a lot of those people.
But you would be amazed at income levels at which it's the electronic, their
That's
phone.
probably true,
Right,
right?
well, right.
That comes
Mhm.
first.
Right.
I think for a lot of the population that you're talking to, they are going to the free clinic. They are
Yeah.
going into ERs.
Food
and
shelters.
They're going to
they're going
Food
to, they're
shelters.
going to food shelters. They're going to a lot of those places. And so that actually is the
That's really
benefit
good.
of the regional enrollment network strategy versus we're going to pump, $5 million in it. Not with no disrespect of advertising, because I know that that's good too.
We'll take it.
Yeah, I know you'll
Yeah.
take it, but I mean, that's kind of the difference is
Right.
there will be that. There's no question about that, but how do you build that sustainable grassroots network that does get to those individuals? I mean, one of the areas that we reached out early was we talked to the Department of Veterans Affairs,
Yeah.
because we recognized they've got 8 homeless vet shelters across the state, and I said, look, guys, at 100% of FPL or below, let's fill out the application, get them in right away.
Right.
Let's get rid of let's move people into where they need to be. And again, Kitty's right. We're working with corrections as well. So when people are moving out of corrections, if they're in large chunk of them will be below 100% of federal poverty level, but making sure that are they Medicaid eligible? How do we help them if they are above 100% into the marketplace? So we're looking at a lot of different ways, but it all comes back to the individual and where they touch the system, as opposed to trying to figure out, as Kitty said, what that global message is, which a lot of times gets missed.